So the first one is, what is geriatric assessment and who needs one? So the number of people who are older is increasing significantly as the baby boomers are getting older and people are living longer. So now we have more people living with chronic multiple illness, and they are more vulnerable to being disabled and having a diminished quality of life. So thinking of who benefits most of getting a geriatric assessment, there are two extremes who do not benefit, and that should be your seriously ill patient who may be already unstable and therefore performing an assessment will not benefit because you're not uncovering something early. The other extreme is that very healthy patient. We have some of those who are, doing sporting events, out mowing the yard, and, they may just need a few preventive measures. They're very, very active. So who benefits the most of a geriatric assessment are those people with multiple biopsychosocial problems and who have disorders that may require rehabilitation. Other possible triggers could be people who have multimorbidity, if there's been cognitive changes, frailty, or medication non-adherence. So what is comprehensive geriatric assessment? It's an assessment that aims to determine the patient's medical status, psychosocial status, functional capabilities, and functional limitation. Is labor and time intensive, but it's an important part of the care to diagnose geriatric syndromes and comorbid conditions in older adults. And the idea is to develop an overall plan of treatment and long-term follow-up to improve quality of life. So here are the components of the geriatric assessment. We have the medical assessment, which will be some of the standard things you do, your problem list, your comorbid condition, reviewing the medications, the nutrition. Then we have the functional status, which is very important in geriatrics. What can you do? How are you doing it? So the activities of daily living, instrumental activities of daily living, what activities or exercise do they do? What's their gait and balance? Then there's a psychological assessment, which includes cognitive and mood assessment. And then there's a social assessment where you look for information to see if they have any needs or and do they, what are their resources? Do they, also some financial assessment. And then there's an environmental assessment to assess their home safety and their transportation needs. So why do you need a comprehensive geriatric assessment? Because you will expose some of the common geriatric syndromes in your patients and you want to expose it early. So the common geriatric syndromes are the dementia, depression, delirium, fall, gait and mobility problems, polypharmacy, maybe sleep disorders, hearing, vision impairment, incontinence, and failure to thrive are things that you could find. As far as the geriatric functional assessment, then we have the activities of daily living and the instrumental activities of daily living. So I'm gonna, in the next slide, discuss more in detail. But if you think about the activities of the daily living here in the bottom, then we have these are the basic activities that you need to live at home. So being able to eat, being continent, being able to ambulate, transfer yourself, get dressed, being bathed. And then we have on the top, we have the instrumental activities of daily living. And so then that includes transportation, shopping, housework, laundry, meal preparation, medications, finances, and using the telephone. So those kind of interact with the needs of the patient in their cognitive, environmental, psychosocial, and physical domains. So it's important to kind of address the activities of daily living, instrumental activities in daily living, as they will interact with the patient.